let's continue working with this unit. And now we're gonna focus our attention to the second objective, that is to talk about a patient discharge plan. In addition to what we checked in our previous video about the different instruments that a patient needs to use after he or she has been discharged, we need to talk about the plan. So what happens after a patient is discharged? In this image, we can see that we have different aspects that we need to consider when discharging a patient. In the previous video, we were talking about the special equipment. But in addition to this, we need family support, problems to watch out for, contacting your healthcare provider, follow-up appointments, talk about medications. In fact, these two will be covered in the following two videos. The post-discharge care and helping with special tasks. So if you observe here in this image, we have the different parts of the discharge plan. So we need to start with the post-discharge care. Okay, so that is the first thing that we need to check. Okay, and what about the second point is to taking medication. In this case, you need to explain the patient if some drugs are prescribed, if there will be side effects of these drugs, if the patient will need over-the-counter drug, or any supplements. So it is important to include this in your plan. The third aspect to consider is the special equipment, what we checked in the previous video. Okay, so we need to mention, for example, the walking stick, or if they will need something special when leaving the hospital, like the bars that we were checking. Maybe the family members need to include those elements in their houses, so it is important to mention this. The fourth element in a discharge plan has to do with the problems to watch out for. Okay, so what are these problems? You need to indicate them, how to deal with them. For example, what happens if the patient falls down, if the patient feels any pain, or something related to the situations that occur after leaving the hospital. Okay, so you need to ask for the name and the number of the person to call if experiencing problems. Okay, don't forget that you need to give this information to your patient. The following part is helping with special tasks. So, for example, what about giving a shot? What if the family members of this patient don't know how to give a shot? So maybe you need to explain this to them. So you also need to explain to them how to use the special equipment. Okay, and maybe you need to demonstrate this to the patient and the families, the family members. Then the sixth element has to do with the family support. Obviously, we know that not only the patient is the one going through this process, but also the family. Okay, sometimes they will need to go to some support groups. For example, in the case of a patient having, I don't know, cancer or receiving chemotherapy, sometimes the family members, the next of kin, don't know how to handle this situation. So it is important to give them some support groups, or even ask them to attend some therapy. Okay. Then we have contacting the healthcare provider. This is important because this is something that we're going to be checking in one of the following videos, that has to do with either having a further appointment or a follow-up appointment, or we can talk about the idea of contacting the doctor in case of any emergency. So it could be either the doctor or the nurse in charge. Maybe in Mexico it's not that very common that nurses can give a follow-up, but still you can give your phone number or your email address to the patient or the next of kin, so that they can contact you in case they need some help. Okay, and as I was telling you a moment ago, it is important to continue with the follow-up appointments. Okay, so now observe this. We also need to make sure that the patient has the ability or not about doing some activities like bathing. Okay, ambulation, it means moving around, toileting, transferring, eating, and dressing. So if you check in this recording, you will observe different parts or different situations in which you will mark if the patient is independent or not. Okay, this is important when you are discharging a patient because you need to indicate not only the patient, but also the next of kin what they can do or not when they are at home. Okay, so moving around, getting a shower, eating, dressing, etc. Okay, so when you're indicating these situations to the patients, it is important to use conditionals. In this case, we're going to be using two types of conditionals. Okay, what is a conditional? It is to offer a solution to a problem or to give instructions. For example, if you have any questions, call the helpline. So these are the situations that patients may face, and that is why we're using an if. I'm quite sure that you are very familiar with this grammar because you may have checked it in previous courses, but still it is important for you to know that we're using this when we are offering solutions to problems or when we are giving instructions. And when we have the first conditional, we use it to talk about possible situations and the results in case something happens with the patient. For example, my husband will help me if I have problems. Okay, so we're going to use if plus the present tense and the future tense in the first conditional. And in the zero conditional, we have if, present tense, and present tense. Okay, so I want to show you the practice in Blackboard. So are you ready?